Hello.
Hi.
Before entering this patient room, I'll make sure I have the correct orders and the correct equipment. Then enter, introduce myself, make sure I'll phone in. After introducing myself, I'll provide privacy, come over, verify the right patient, and the date of birth. Hello, so I see we have Robin here with a date of birth, well, Robin Hood with a date of birth of September 13th with no year, plus we have the MRN number. After I do that, I'll come over and explain to the patient what procedure I'll be moving forward with. In this case, is a Foley catheter insertion, which is a device that we'll be installing in the patient or inserting in the patient to relieve urine from their bladder to make it easier for the patient to use the restroom. After I let the patient know about that, I also want to know if the patient is allergic to iodine or latex, because them are two things we'll be using today, and we would not want this patient to have an allergic reaction to it.
No, I'm not allergic.
Perfect, thank you. So before moving forward, I also want to make sure I clean the patient, perineal care. With that, we can use soap and water. When we're using that, we'll just make sure it's not soiled down there so we can keep our sterile field sterile. After using soap and water to clean this patient, I will use gloves and hand hygiene and after also. So in this case, I'll hand hygiene out, take the gloves off, and move forward with my Foley catheter insertion. So after moving forward, there's no way to adjust this bed, but I adjust this bed. I'll make sure my table is like waist height with me, and then move forward with the procedure.
You can't turn your back on your table.
And I would not be able to turn my back during the procedure at all, or towards the table, my sterile field. So in this case, I'll position myself like this, so I will not be able to turn my back towards my patient. So here, I'll have a trash bag next to, garbage next to me in this case, but I guess I'll use the patient feet. I make sure the patient is in a position to make it easier for me to insert the Foley catheter. Hand hygiene, this up way. I'll start by using my sterile glove, or putting on my sterile glove. In this case, we have a 1-inch border. That is not sterile. And that's what we'll use to open it. So I'll start with my dominant hand first. Let's see. To get that one on, I'll come over here and get this one on. Dispose of that. Then starting this Foley insertion off, drape the patient. Everything is sterile inside here, so sterile can touch sterile.
It's supposed to drape the other way. It's okay. It's okay.
That's you. No. From there, we'll open the Foley catheter. This is kind of funny. Well, we'll start by opening it away from us in this case. Then like, you know, in that order. And then from there, I'll insert, make sure we have all the equipment that we need in here. So some equipment we'll need is the lube, the iodine. Make sure we have the syringe to inflate the Foley catheter balloon to make sure the Foley stay in place. So first things first, I want to prep my lube here. So we have lube here. After I put the lube there, I can discard it. No need for that anymore. And then make sure I get this prepared. In this case, I'll lube this up very well. Let it sit there. Then we'll also attach the balloon over here. So after doing all that, we'll start by sterilizing our patient here. So we have 3 swabs. We'll start by, let's see, placing the swabs here. Use my non-dominant hand, separate the labia. Start by the labia that's away from us. Then discard that. Start by the labia closest to us, or next labia closest to us. And last but not least, go down the middle. After doing that, I'll use my dominant hand to grab the Foley. I'll bring the Foley over. Now this hand will stay sterile and I will not break sterility. So I'll insert this until I get a flash back, and after I get a flash of urine, I'll insert it 2 more inches. So I'll go, and I will insert it into the urethra. I guess we're gonna use some real length. You can move that over here for me real quick. Thank you. There we go. So in this case, we got a flash, so I go 2 more inches. After going 2 more inches, I'll use my non-dominant hand to keep the Foley in place, and I'll inflate the balloon. After inflating the balloon, I give it a light tug to make sure it's secure. In this case, it is secure. So after that, I'll make sure to install the stat lock, and I'll do that by placing that on the inner thigh, because here we are dealing with a female patient. Installing the stat lock there, I will remove my drape also as well. It will not still be here, but in this case, if we remove it, we'll end up ripping the drape, which we are reusing. So I'll put my Foley bag to catch the urine on the part of the bed that cannot move, and I'll start cleaning up. I'll also express to the patient that if they're having any discomfort, to please notify the nurse or nurse, so we could come assess the patient and make sure everything is normal. We'll want to clip this to the bed or the patient clothing, so it will be secure. After doing all that, I'll make sure I want to document, or before leaving the patient room, I make sure I want to document the size of the fringe, how much milliliters I use to put inside the Foley balloon, and how did the patient tolerate it. After doing all that, I'll make sure I clean this patient up, get the patient back comfortable, give the call bell light to the patient, see if the patient have any questions. I will lower my bed back down to the lowest part, take my gloves off, make sure everything clean once again, and foam out. Thank you.